Every 66 seconds, another older adult in this country is told they have dementia. And behind some of those diagnoses may be a factor that many families never think to question: a medication sitting in the medicine cabinet. I'm Dr. Andrew Parker. After years of caring for older adults, I've seen how frightening memory changes can be. Someone who was mentally sharp for most of their life suddenly starts forgetting names, missing appointments, repeating questions, or struggling with familiar routines. The first assumption is often simple: they're getting older. But sometimes there may be another explanation worth investigating. Certain medications can affect memory, attention, alertness, or thinking, particularly in older adults. And because these medicines may have been recommended by a doctor or purchased over the counter, many people never consider that their medication could be contributing to the problem. Today, we're going through 9 medications and medication groups that have been associated with memory or cognitive problems in older adults. We'll start with the ones that are often overlooked and work our way toward the medications that deserve the closest attention. And pay special attention to number 3, because it belongs to a category that many older adults take for a problem that seems completely ordinary. Before we begin, tell me in the comments, what age are you, and do you take medication every day? Your answers can help me understand what health topics matter most to this audience. Let's begin with number 9. Number 9, Diphenhydramine. You may know this medication by the brand name Benadryl. It's commonly used for allergies, cold symptoms, and sometimes sleep. Because you can purchase it without a prescription, many people assume it must be harmless. But being available over the counter does not automatically mean a medication is harmless for older adults. Diphenhydramine belongs to a group of medicines called anticholinergics. In simple terms, these medications interfere with the action of a chemical messenger called acetylcholine. Acetylcholine plays an important role in attention, learning, memory, and other brain functions. That matters more as we get older. Older adults can be more sensitive to medications that affect the brain, and anticholinergic drugs can sometimes cause confusion, drowsiness, difficulty concentrating, and memory problems. Think about someone who takes a nighttime allergy or sleep product every evening. They may wake up feeling unusually foggy, forget something they normally remember, or struggle to concentrate during the day. They might blame poor sleep, they might blame age, but they may never think to look at the medication beside their bed. That is why I want you to check the labels of products marketed for nighttime, sleep, allergies, or cold relief. Diphenhydramine can appear in different products under different brand names. And there is an important point here. Do not stop a medication simply because you heard this video. If you regularly use diphenhydramine, talk with your doctor or pharmacist. Ask whether there is a safer alternative for your particular situation. For allergies, your healthcare professional may recommend a newer antihistamine with less effect on the brain, depending on your health history and other medications. The key lesson is simple. Never assume that an over-the-counter medication is automatically safe for long-term use, just because you don't need a prescription to buy it. Now, let's move to number 8, because this next medication group is extremely common among people dealing with heartburn and reflux. Number 8. Proton pump inhibitors. You may recognize names such as omeprazole or esomeprazole. These medicines belong to a group called proton pump inhibitors, or PPIs. They reduce the amount of acid produced by your stomach and are commonly prescribed or recommended for conditions such as acid reflux, heartburn, and ulcers. For many people, these medications can be very helpful. But here's something important. Using a medication for a long period of time should always involve an occasional review with your healthcare professional. Why? Because reducing stomach acid can affect how the body absorbs certain nutrients and minerals. For example, long-term PPI use has been associated with lower levels of vitamin B12 in some people, as well as changes involving magnesium and other nutrients. And vitamin B12 is important for normal nerve and brain function. If someone develops a significant deficiency, symptoms can include weakness, numbness, difficulty concentrating, and cognitive changes. But I want to make something very clear. That does not mean that taking a PPI automatically causes dementia. The research examining PPIs and dementia has produced mixed findings, and an association between medication use and dementia does not prove that the medication caused the disease. That's why the right response isn't panic. The right response is a conversation with your doctor. If you've been taking a PPI every day for months or years, ask whether you still need that dose, whether the medication should be continued, and whether monitoring certain nutrients makes sense for you. And never suddenly stop a long-term reflux medication without medical guidance. Your symptoms can return, and some people can experience an increase in acid production after stopping certain medications abruptly. Your goal should always be the right medication, at the right dose, for the right reason. Now let's move to number 7. This one is especially important because it involves a problem that many older adults may feel uncomfortable discussing. Number 7. Certain bladder medications. One medication that deserves attention is oxybutynin, commonly used to treat symptoms of overactive bladder. If you've ever experienced a sudden, powerful urge to urinate or found yourself constantly worrying about getting to the bathroom in time, you know how disruptive that problem can be. For some people, treatment can make a major difference in daily life, but oxybutynin has anticholinergic effects, meaning it can interfere with acetylcholine, the same chemical messenger we discussed earlier. And because some anticholinergic medications can enter the brain, older adults may be particularly vulnerable to side effects, such as confusion, drowsiness, and cognitive changes. This is where medication reviews become so important. Imagine an older person who starts experiencing bladder problems. They receive medication, their urgency improves, but months later, their family notices something else. They're forgetting appointments. They're losing track of conversations. They're misplacing their keys. Maybe they're repeating the same question. Everyone assumes it's simply aging. But when memory or thinking changes appear after starting or increasing a medication, that timing is worth discussing with a healthcare professional. It doesn't automatically mean the medication is responsible, but it deserves to be investigated. And please remember, never stop a bladder medication on your own. There may be other treatment options, but the safest choice depends on your overall health, other medications, kidney function, blood pressure, and the specific bladder symptoms you're experiencing. A medication review with your doctor or pharmacist can help determine whether the benefits still outweigh the possible risks. And this brings us to an important lesson that applies to every medication on today's list. Don't just ask, does this medicine treat my problem? Also ask, could this medicine be affecting my memory, alertness, balance, or thinking? That one question can lead to a very important conversation. And we're only at number 7. There are still 6 medication groups to discuss, including some that older adults may take every single day without realizing they could potentially affect the brain. If you take oxybutynin and have started noticing changes in your memory or thinking, don't simply ignore them. That does not mean the medication is definitely responsible, but it is a good reason to review your treatment with your doctor. You may have more than one option for managing overactive bladder. Some newer medicines, including mirabegron, work through a different pathway and do not have the same anticholinergic effect as oxybutynin. Whether it is appropriate for you depends on your medical history and other medications, so let your healthcare professional make that decision with you. Remember, the goal is not to choose between bladder health and brain health. The goal is to find the safest treatment that manages both. Now, we're moving to number 6, and this one may surprise you because it is among the most commonly prescribed medications for older adults. Number 6, statins. You may recognize names such as atorvastatin or simvastatin. These medications are used to lower cholesterol and reduce the risk of serious cardiovascular problems, including heart attacks and strokes. And I want to make something very clear before we continue. Statins can be extremely important medications for many people. This is not an argument against taking them. In fact, stopping a statin without medical guidance could increase your cardiovascular risk. But some people taking statins report cognitive symptoms such as forgetfulness or mental fog, and researchers have investigated whether there may be a connection. The evidence is complicated. Some studies have reported an association between statin use and cognitive symptoms, while other research has found no increased risk of dementia and has even suggested possible protective effects. So, we should not tell you that statins cause dementia. That would be an oversimplification. What we can say is that if you began noticing unusual memory problems after starting a medication, that timing deserves a conversation with your healthcare professional. Think about a person who has taken the same statin for several years and suddenly begins experiencing episodes of forgetfulness. They forget a familiar name. They lose their train of thought halfway through a conversation. They walk into a room and cannot remember why they went there. Should they immediately stop the statin? Absolutely not. Instead, they should tell their doctor exactly what they have noticed. Your doctor may consider the dose, the specific statin, your other medications, your cholesterol levels, and your overall cardiovascular risk before deciding whether any change is appropriate. And remember that not every statin behaves exactly the same way in the body. Some are more likely than others to enter the brain, but that does not mean one particular statin is automatically safe or dangerous for everyone. Your individual situation matters, so if you're taking a statin and experiencing new or persistent cognitive symptoms, don't suffer in silence and don't stop the medication secretly. Bring the concern to your doctor. A medication review can help determine whether your symptoms could have another explanation or whether your treatment needs to be adjusted. And if you're finding this information useful, take a moment to tap the like button. It helps this video reach other older adults who may have the same questions about their medications. And I'd also love to know something. How many prescription medications do you currently take each day? You can leave the number in the comments. Now, let's continue. Number 5. Benzodiazepines. This group includes medications such as lorazepam, diazepam, and alprazolam. You may know them by brand names such as Ativan, Valium, and Xanax. These medications are commonly prescribed for anxiety, panic symptoms, and sometimes sleep problems. They work by strengthening the effect of GABA, a chemical messenger that helps calm activity in the nervous system. And when anxiety is overwhelming, that calming effect can feel like a lifesaver. The racing thoughts slow down, the body relaxes, sleep may finally become possible. But older adults can be particularly sensitive to these medications. They can cause sleepiness, dizziness, slowed thinking, impaired coordination, and problems with attention and memory. And there is another concern: dependence. When someone takes a benzodiazepine regularly for an extended period, the body can become accustomed to it. That means stopping suddenly can cause serious withdrawal symptoms. Depending on the medication, dose, and duration of use, withdrawal can include severe anxiety, insomnia, agitation, and in some cases seizures. So please remember this: never abruptly stop a benzodiazepine that you've been taking regularly. If you believe it may be affecting your memory or making you feel mentally foggy, talk to your doctor. A healthcare professional can create a gradual tapering plan when appropriate. That process may take weeks or months, depending on the person. And there are other approaches for anxiety and insomnia. Some people may benefit from non-drug treatments such as cognitive behavioral therapy. For chronic insomnia, a specialized approach called cognitive behavioral therapy for insomnia, or CBTI, is often recommended as a first-line treatment. Other medications may sometimes be appropriate, but there is no single substitute that is right for everyone. Your doctor needs to consider your age, other medications, fall risk, medical conditions, and the reason you originally started the benzodiazepine. So, if you've been taking one for a long time, don't panic. Don't stop it tonight. Instead, start a conversation with your healthcare professional about whether it is still necessary and whether a gradual reduction could be appropriate. Now we're getting closer to the top of the list. Number 4. Amitriptyline. Amitriptyline, sometimes sold under the brand name Elavil, is an older medication that can be used for several different conditions. It may be prescribed for certain types of nerve pain, migraine prevention, depression, and sometimes sleep problems. That versatility has made it useful for many patients, but there is an important issue for older adults. Amitriptyline has strong anticholinergic effects. That means it can interfere with acetylcholine, the same chemical messenger we discussed earlier when talking about diphenhydramine and oxybutynin. And this is particularly important in older adults because anticholinergic medications can contribute to confusion, constipation, dry mouth, blurred vision, urinary problems, and cognitive impairment. Long-term exposure to strong anticholinergic medications has also been associated in observational research with a higher risk of dementia. But again, we need to be precise. An association does not prove that amitriptyline directly causes dementia. Many other factors can influence dementia risk, and people who take these medications may already have medical conditions that affect cognitive health. So don't hear this and assume that your medication has damaged your brain. Instead, ask a better question. Is this still the best medication for me today? That is especially important if you've been taking it for years. For example, someone may have originally received Amitriptyline for nerve pain and continued taking it long after their symptoms changed. Another person may have started it for sleep and never revisited the treatment. Medication needs can change as we age. Your kidneys, liver, blood pressure, balance, sleep, and other medications can all change over time. That is why an annual medication review can be so valuable. There may be alternative treatments for certain types of nerve pain or migraine, but the safest choice depends on the individual. And please don't replace amitriptyline with another medication on your own. Even medicines that sound safer can have important side effects or interactions. Talk with your doctor or pharmacist first. If you're taking amitriptyline and have noticed increasing confusion, unusual drowsiness, memory problems, or difficulty concentrating, mention those symptoms specifically. Don't simply say, "I'm getting older." Tell your healthcare professional exactly when the symptoms started and whether they changed after the medication or dose changed. That information can be extremely helpful. And now we have reached number 3. This is the one I told you to watch closely because it is commonly prescribed for a problem that may seem completely harmless at first. But the medication involved deserves a much closer look. Number 3, paroxetine. Number 3 is paroxetine, which you may know by the brand name Paxil. Paroxetine is an SSRI antidepressant. These medications are commonly used to treat depression, anxiety, panic disorder, and several other conditions. For many people, antidepressants can be an important part of treatment, but paroxetine has one characteristic that makes it different from several other SSRIs. It has strong anticholinergic activity, and by now, you know why that matters. Anticholinergic effects can interfere with acetylcholine, a chemical messenger involved in attention, learning, and memory. Older adults can be especially sensitive to medications with strong anticholinergic properties. That is one reason paroxetine appears on the American Geriatric Society Beers criteria, a list used by healthcare professionals to identify medications that may carry additional risks for older adults. This doesn't mean that everyone taking paroxetine will develop memory problems. It also doesn't mean you should stop taking it. It means that if you're an older adult taking paroxetine, it is reasonable to ask your doctor whether it remains the best choice for you. There may be other antidepressants that are more suitable for some older adults, including medications such as sertraline or escitalopram. But the right medication depends on your symptoms, medical history, other prescriptions, and how you've responded to treatment in the past. So, if you've been taking paroxetine for years and you've recently noticed increasing forgetfulness, difficulty concentrating, or unusual mental fog, bring those symptoms to your doctor. Don't make the decision yourself. A gradual, medically supervised change may be appropriate in some cases, but antidepressants should not be stopped suddenly without professional guidance. And remember something else. Depression itself can affect concentration and memory. So, when an older adult develops cognitive symptoms, healthcare professionals need to consider both the illness and the medication. That is why a proper medication review is so important. Now, we reach number 2. And this category deserves special attention because these medications are sometimes prescribed to older adults for reasons that have nothing to do with the conditions they were originally designed to treat. Number 2, antipsychotic medications. Examples include quetiapine, risperidone, and olanzapine. These medications were developed to treat serious psychiatric conditions such as schizophrenia and bipolar disorder. They can also have legitimate uses in certain situations involving severe behavioral symptoms. But here's where caution becomes extremely important. Sometimes antipsychotic medications are prescribed to older adults for agitation, severe behavioral symptoms, or sleep problems, including in people living with dementia. And these medications can carry significant risks in older adults. They can cause sedation, dizziness, movement problems, and impaired alertness. They can also increase the risk of falls and, in certain older adults with dementia-related psychosis, have been associated with an increased risk of stroke and death. That's why these medications should never be treated like ordinary sleeping pills. If your parent, spouse, or another loved one is taking an antipsychotic medication, ask the prescribing healthcare professional a simple question. What specific symptom are we treating with this medication? Then ask, is it still necessary? And finally, could we try a lower dose or another approach? Those are reasonable questions. Behavioral symptoms in older adults can sometimes have an underlying cause that needs to be addressed. Pain is one example. So is constipation, urinary discomfort, infection, dehydration, poor sleep, medication interactions, hearing problems, and an unfamiliar environment can also contribute to agitation or confusion. Sometimes improving the environment can help. A calm routine, adequate lighting, familiar surroundings, regular sleep, and reducing unnecessary noise may make a meaningful difference. Medication may still be necessary in certain serious situations, but the principle is usually to use the lowest effective dose for the shortest appropriate period, with regular reassessment, and families should understand why the medication is being used. No one should feel afraid to ask. Now, we have reached number 1, and here's the important twist. Number 1 isn't one specific pill. It's a problem created when multiple medications with anticholinergic effects are taken together. Number 1, anticholinergic burden. You've heard the term anticholinergic several times throughout this video. Now, let's put everything together. Imagine an older adult taking Diphenhydramine at night for sleep or allergies. They're also taking oxybutynin for bladder symptoms. And they're taking Amitriptyline for nerve pain. Each medication may have been prescribed for a completely different reason. The doctor treating the bladder may not realize the patient is taking the nighttime allergy medication. The pharmacist may not know about every supplement or over-the-counter product. And the patient may not realize that all 3 medications affect the same chemical system. That's where anticholinergic burden becomes important. Instead of looking at each medication separately, healthcare professionals can consider the combined anticholinergic effects of the entire medication list. For an older adult, that combined burden can contribute to problems such as dry mouth, constipation, urinary retention, blurred vision, drowsiness, confusion, and cognitive impairment. And this is why a medication review can sometimes reveal something that an individual prescription review misses. You may not have one obviously problematic medication. You may have several medications producing small effects that add up. That's the part I want you to remember. If you take 5, 8, or even more medications every day, don't assume that each one is being considered in isolation. Your doctor and pharmacist should know your complete medication list. That includes prescription medications, over-the-counter medicines, sleep aids, allergy medications, pain medicines, vitamins, herbal products, and supplements. Even something you take only occasionally can matter. So, here's your action plan. Take every medication bottle you have and make a complete list. Write down the name, write down the dose, write down how often you take it, and write down why you take it. Then take that list to your doctor or pharmacist. Ask them to review the entire list for possible interactions, unnecessary medications, duplicate treatments, and medications that may be contributing to confusion or cognitive symptoms. Do not stop anything suddenly unless your healthcare professional tells you to. Some medications must be reduced gradually. Others may be completely appropriate for you and provide important benefits. The goal isn't to take fewer medications simply for the sake of taking fewer medications. The goal is to make sure every medication has a clear purpose and that its benefits still outweigh its risks. And there is another reason this matters. Sometimes cognitive symptoms really are caused by dementia or another medical condition. But sometimes confusion or memory problems can have other contributors, including medication effects, sleep problems, depression, thyroid disorders, vitamin deficiencies, infections, hearing problems, or other health conditions. That means new memory changes deserve proper evaluation. Don't automatically assume they are just part of getting older. What should you do now? If you've noticed new memory problems, start by making an appointment with your healthcare professional. Bring your complete medication list. Tell them exactly what you've noticed. Maybe you're forgetting names more often. Maybe you're repeating questions. Maybe you suddenly feel mentally foggy. Maybe you started having these symptoms after a medication was added or the dose was increased. Those details matter. Your doctor may decide to review your medications, perform a cognitive assessment, check blood tests, or investigate other possible causes. And remember the most important rule from this entire video. Never stop a prescribed medication on your own because you are worried about memory loss. Some medications can cause serious withdrawal symptoms or allow the original medical condition to return. Get professional guidance first. Now, I want to hear from you. Have you ever experienced unusual brain fog or forgetfulness after starting a new medication? Or have you recently had your entire medication list reviewed by your doctor or pharmacist? Tell me in the comments. And if this video helped you understand something you had never considered before, share it with someone you love. A simple medication review could be an important conversation for an older family member who has recently experienced unexplained changes in memory or thinking. Finally, remember that this video is for general educational purposes. It cannot diagnose dementia, determine whether a specific medication is causing your symptoms, or replace personalized medical care. If memory loss, confusion, or changes in thinking are new, worsening, or interfering with daily life, please speak with a qualified healthcare professional. Your medication cabinet deserves attention, but so does the rest of your health. I'm Dr. Andrew Parker. Stay informed, stay proactive, and I'll see you in the next video.